Warfarin is a drug that belongs to the class of drugs known as anticoagulant or blood thinner. It is used to prevent and treat blood clots. Warfarin is also known by the brand names Coumadin and Jantoven. Common side effects of warfarin include bleeding, which is the most serious side effect and can occur in any part of the body. Signs include unusual bruising, nosebleeds, bleeding gums, heavy menstrual periods, pink or brown urine, red or black stools, and prolonged bleeding from cuts. Gastrointestinal issues such as nausea, vomiting, diarrhea, and abdominal pain. Allergic reactions like rash, itching, and swelling. Minor hair thinning or loss. And purple toe syndrome, a rare condition where the toes become painful and purple in color due to cholesterol emboli. Severe side effects requiring immediate medical attention include severe bleeding, such as blood in urine or stool and vomiting blood, unusual pain or swelling, and severe headache, dizziness, or weakness. Warfarin is commonly prescribed for deep vein thrombosis to prevent and treat blood clots in the veins, typically in the legs. Prevention and treatment of blood clots in the lungs due to pulmonary embolism. Prevention of stroke and systemic embolism in patients with irregular heartbeats. Prevention of clot formation in patients with artificial heart valves. And prevention of clot formation after certain surgeries, such as hip or knee replacement. Warfarin works by inhibiting the synthesis of vitamin K-dependent clotting factors, which are essential for blood coagulation. Specifically, it inhibits the enzyme vitamin K epoxide reductase, reducing the regeneration of vitamin K1 epoxide. This action decreases the production of active clotting factors 2, 7, 9, and 10, as well as the anticoagulant proteins C and S, thereby preventing the formation of blood clots. The initial dose of warfarin can vary, but it often starts at 5 to 10 milligrams per day for the first 1 to 2 days. The maintenance dose is usually between 2 to 10 milligrams per day, adjusted based on the patient's international normalized ratio. The target INR range is typically 2.0 to 3.0, but it may be higher for certain conditions, such as mechanical heart valves. Regular blood tests are required to monitor the INR and ensure the dose is appropriate. Warfarin interacts with many medications, supplements, and foods, which can affect its efficacy and safety. Antibiotics, antifungals, anti-inflammatory drugs, other anticoagulants, and certain antidepressants can increase the risk of bleeding. Vitamin K-containing supplements, herbal products like ginkgo biloba, ginseng, St. John's wort, and fish oil can interact with warfarin. Foods high in vitamin K, such as green leafy vegetables like spinach, kale, and broccoli, can reduce the effectiveness of warfarin. Patients are advised to maintain a consistent intake of these foods, and alcohol can increase the risk of bleeding and affect warfarin levels. There are several warnings when using warfarin that need to be considered. Warfarin can cause severe and sometimes fatal bleeding. Patients should be educated on recognizing signs of bleeding and the importance of regular INR monitoring. Warfarin is contraindicated in pregnancy due to the risk of teratogenic effects and fetal hemorrhage. Patients should inform their healthcare provider of all medications and supplements they are taking to avoid interactions. Consistency in dietary vitamin K intake is crucial. Sudden changes can affect warfarin's efficacy. Patients should inform their healthcare providers before any surgery or dental work. Warfarin may need to be temporarily discontinued, and caution should be observed in conditions such as liver disease, kidney disease, and high blood pressure that can increase the risk of complications with warfarin. And that's all for this video. If you found this video helpful, don't forget to like, share, and subscribe for more informative health content. Stay tuned for our next video.